ECU College of Nursing, we're not just educating students to be nurses, but we're preparing them to be part of the transformation in healthcare.
Our partnerships with all of our clinical agencies are central to the education of all of our nursing students because it gives them a varied opportunity. They get to see large medical centers, they get to see smaller regional hospitals and community hospitals. They get to work in community agencies as health departments and schools that are in rural areas where many of our students may end up living and working in the future, and that helps us to give them the experiences that they need to move forward and to move our profession forward.
We intentionally ensure that our learners are immersed in interprofessional settings so that before they go into clinical settings they can learn about, with, and from other interprofessional learners so that when they are in the clinical setting they then understand those roles and how to work together as teams to optimize the healthcare outcomes for consumers.
So we have a 3-week study abroad clinical course in Guatemala that we've had for 8 years now. The students are in clinical every afternoon and they're in language classes every morning with a certified Guatemalan teacher. But in the afternoon they go to public schools and the schools have asked us to do certain health topics that we call charlas in Spanish, and they've been asked to teach hand hygiene, nutrition, and dental hygiene. What I think an international immersion course does is address the mission of ECU, which is to prepare global citizens for a multicultural society.
We're not just learning to be nurses or nurse scholars in the PhD program. I think we're learning to be leaders. We're learning to be, I heard in one of my PhD classes, we're learning to take the role as shepherds of our field. We're the ones that are going to help to develop knowledge, to help bring it to the practice level at the bedside, to be the ones that change policies. We're going to be the ones that are the transformation.
Being on the Interprofessional Health Science Student Leadership Council and the College of Nursing Student Leadership Council has made me feel more involved with the campus community. It's given me the opportunity to build my communication skills and be more comfortable interacting with healthcare disciplines.
As a student here, I've been involved in the community, whether that's joining a student organization or being part of a community outreach program. I really feel like I have had the opportunity to impact lives and develop myself both personally and as a nurse.